Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Reinier Schuur. Joining me back on the show is Dr. Colleen Smith and Jared Rhoads to continue our discussion of rethinking American healthcare from a philosophically informed and pro-freedom perspective. Welcome back to the show.
Thanks, Ray. Nice to be back.
Thanks for having me, Ray.
So healthcare is certainly in the news these days. And rather than giving our analysis of what's going on at this very moment, which is changing by the minute almost, I thought it would be more valuable for our audience to give them a more enduring perspective so that when the dust settles and certain policy solutions become clear, they'll be armed with a wider perspective from which to judge whatever comes out of this process. And I think a good place to start with that is to simply ask, what even is this debate really about?
Yeah, let me jump in. So the debate that you'll hear if you turn on any news station right now or look at the news websites has to do with the ACA enhanced subsidies, and this is something that came out of the COVID era, where some enhanced subsidies were offered to people who signed up for Affordable Care Act plans in the marketplaces there. Those are set to expire, and there was some negotiation done around whether to continue them or whether to let them expire as part of the negotiations around the recent shutdown. But that debate is it's very specific, it's very narrow, and it's not it's not very essential. This will come and go, and so like you said, Ray, it would be probably interesting to look at sort of the deeper, more fundamental questions here. And one of the things that gets talked about with regard to all this is the concern over the affordability of healthcare for the people, particularly on with regard to this particular issue, the ACA enhanced subsidies. It's the affordability of healthcare in general for those people. And so I think we're kind of gathered here to talk about, like, how does what exactly does that discussion look like, and who do people trust on that? Which is there one side or the other that's right on it? I think that's what we'll dig into today.
I think that's true. I think it's also, both sides of this argument talk about affordability, but how they approach affordability, what they define as affordability, affordability to whom, is different depending on which group you talk to. And so I think what we want to do is kind of take a wider approach to say, is affordability really what matters most in this debate either?
Right. I think the affordability is a real issue now because it's the one thing where the Democrats saw that they had a winning edge over the Republicans, or at least when it comes to healthcare. And so I think part of what's motivating this debate is, who do you trust on healthcare? And what's interesting about affordability is that, yes, people struggle with the cost of health insurance, rising premiums, but it's not just an economic issue. It's also a more moral, kind of social issue of how do you make things affordable. And you can see that in cases like Zohran Dami, who's wants to make groceries more affordable. If you really wanted to, he would let Walmart into Manhattan, but they're not allowed, right? So he wants to indicate to his constituents that the government is here to help with all sorts of things, right? And so, like, it's like a deeper role of government, and that's how we get things more affordable. And because that's the wider perspective. And I think that's what we should also be doing with this debate. We should be not looking at just like the technical policy solutions, how they would actually bring down the cost of premiums, but where is that all coming from? And what is the general approach that each side is taking? And that's definitely the main thing that we want to do for this episode. And let's start off with the left side of the spectrum. For lack of a better term, we'll call this the progressive approach to healthcare reform, which is not to say that there are variations within that, but just as a general kind of impulse, and not just now, but throughout the history of American healthcare. What is the progressive approach to healthcare reform?
I think the general progressive outlook on healthcare, and again, you did say that there is a spectrum, but I think you could look at potentially people like Bernie Sanders who advocate for a complete socialized healthcare system, Medicare for all, single payer healthcare state. And they're really talking about access to healthcare being equated with freedom. Freedom to access healthcare should be provided for everyone. Healthcare is a right. It shouldn't matter who you are. You should be able to get this healthcare free of charge.
And I think that, on this side, on this progressive side, they really want um, healthcare to be guaranteed in some way. They don't, there isn't much of a trust of markets to provide this, even though, they might trust markets to provide the groceries in the grocery store or, and other walks of life. But there's a real fear, and some of it is well-founded because we have such a strange healthcare system currently in the US. You look around and there's weird things where, yeah, if you were to, get a certain diagnosis, you might not be able to afford the care that's on offer today. But and so if you were to simply say, well, if I didn't have some sort of government guarantee, how well would I do? And people, get nervous about that. I think part of the maybe failure here is to imagine how things would be different, and I think they would be quite different under a much more market-oriented system.
So I think a relevant place to go next is to ask how receptive has the American public been to these ideas, this progressive approach to reforming healthcare. And historically, certainly the attempt to have comprehensive healthcare reform that was universal was rejected. It was rejected because doctors rejected it. While they didn't want free markets, they didn't want government control of healthcare. And they scared the American public into saying, well, this is socialized healthcare, and like you're not going to be able to have a real relationship with your doctor anymore. Um, and so what happened then is then they realized that, well, the way that we get more socialized healthcare, more access to healthcare according to their ideals is through an incremental approach, through focusing on specific groups of people, the elderly, the poor, the disabled, uh, single women with children. Um,
Pregnant women.
that's right. And
And that's expanded now to, sorry, and that's expanded now to things like dialysis patients, patients needing long-term care. And I think if you look at any one of these specific groups, you will also see that there's a strategy of getting as many possible people into that group in order to provide them with this idea of universal health care.
But I think one thing that's interesting about the incremental approach is that each time a program is created or gets expanded, there'll be a fight about it, but eventually the general public gets used to it, and then it's not so radical anymore. And so, what was initially a pretty radical idea of complete universal um healthcare for everyone, where the government plays a huge role in the provision of healthcare, incrementally gets more and more accepted over time um, because if you have access to care for the elderly, the poor, and then like, well, then really, how radical is it to have it for other people? And like, why don't they deserve access to healthcare? And then I think there's a real brilliance behind this approach, also because there's no principled way to say, well, I think single mothers with children should have access to this kind of care, but working young men shouldn't. But why? I mean, they're starting out in life. They can struggle. Healthcare costs are insanely high. Why aren't they deserving? And I think, as we will see, the conservative approach hasn't really had a proper response to that.
I'll jump in. It's kind of like intentionally setting up a slippery slope and then watching us all kind of slide down it. It's a hard thing to resist. I agree. And it's kind of borne out by the specific numbers too. These days there are more people on Medicaid in the United States than on Medicare. That was not really ever expected to be like that. Medicaid, we have something on the order of 75 to 80 million people on Medicaid. It's like one in every four or so, 4.5 people uh, on Medicaid in this country, where that was supposed to be. It's supposed to be for low income individuals. Going back. In Medicare, we have something like 65 million or 67 million people on that program, and again, it's a larger and larger portion of people who are connected to these programs, and then those programs. We don't have to get too into the details on this, but those programs are become influential in other ways that end up, kind of dictating how medicine is practiced and how even just the structure of healthcare is delivered. And they end up having an outsized influence on the rest of the market, almost to the point where there is no market anymore.
Yeah, I mean, all of pricing is tied to Medicare and Medicaid pricing. And I think you can see how slippery the slope is when you look at the big beautiful bill and the backlash that's come out about when the Conservative Party has tried to limit the number of people who can be on Medicaid. And we're seeing, headlines in the New York Times, the big beautiful bill is kicking thousands of people, hundreds of thousands of people off Medicaid. So many people will lose their health insurance. Nobody wants that. Even many conservatives don't really want that to be the outcome of their big beautiful bill. Um, but we're all just going down this slope.
Right. And I think what we would then have to contend with is the fact that the progressive approach to reforming healthcare has the momentum, right? And as much as people might say that Republicans and their constituents don't like Obamacare and maybe don't even like other programs, it's that's not really relevant. I mean, like if they don't like the programs, it's very often that they're upset with its failure to live up to what it was claimed to be, that they will give care to the people who needed it, and they're not getting it. Like with the VA, with Medicare, with Medicaid, main complaint is that we agree with these programs, but they're not working well. And so if your main kind of approach to them is like, oh, they're bad because they're not being run well, then you're not really pushing back against the progressive approach to reforming healthcare, which their response could just be like, yeah, we agree these programs are not run well. We should just have Medicare for all, right? So with that, I think we can now turn to, well, what alternative are we being offered to this progressive approach to reforming healthcare? What's the conservative approach to reforming healthcare? And I use that term broadly. Again, there's a spectrum of views within the Republican Party, but just as a general impulse, how would we capture the conservative approach to reforming healthcare?
I think there are a few ways to look at it. One way I look at it is that as the progressives have sort of set the tone for they're the ones actually with the moral ideal, their moral ideal, that they've managed to articulate. And it's the conservatives that are more kind of the reactionaries on this, and they're looking at their opponents, their political opponents, and saying, well, I'd like to tap the brakes on this part or on that part. We should go a little bit slower on this. They don't really have an ideal of their own, but they'll oppose the progressive view. This kind of brings up this reminds me of Brian Kaplan's definition of progressives and conservatives, and he talks about progressives and Democrats as being primarily anti-market, and he talks about conservatives and Republicans as being primarily anti-progressive. And I think there's some truth to that, where you have conservatives that are primarily kind of determining their own views on this in relation to, as a response to it, and in reaction to what's happening on the other side. Um, I could say a couple of more positive things about the conservative side, which is that from time to time they will, and I don't know if they're borrowing these ideas from various people, but they they'll occasionally, hit upon a couple more market-oriented things. But because it doesn't really, they don't really hold it as like a unified and moral kind of ideal. It ends up being very very piecemeal.
And I think the way this has manifested is that we get things like new ideas and new programs from progressives who are going through this incremental approach. The Affordable Care Act is one example of that. And then what we get from conservatives is instead of new ideas or, any sort of forward momentum or progress in the healthcare space, we get opposition and changes that try to roll back the things that Democrats have done or advocating going back to the way healthcare was in the 50s rather than kind of thinking big picture and imagining what other way we could approach healthcare that might be completely different.
Yeah, I think what's striking about the conservative approach to reforming healthcare is that it strains my mind to call it an approach. I mean, I like when I sat down and I tried to think, what did I really stand for? Very often, the things that came to mind are all put in negative terms, right? Like they're against government healthcare, they're against socialized healthcare, and on some level, they don't fundamentally disagree with the progressives. Like they might say that healthcare is not a political right or legal right that the government should provide. But they definitely think that healthcare is something that the government has a role in making sure is facilitated in the right way, right? So like there's a kind of like a moral right to receiving healthcare in a particular way where um the government should shape the market in particular ways. And you see this not just in the Republican Party, but in the American Medical Association, which at the very beginning was very conservative and not free market, that they wanted to use state medical boards to shape the doctor-patient relationship. And the reason why they found allies in the Republican Party is that they wanted to keep the government out, but that's not because they wanted to bring the market in. They just wanted to keep the federal government out. But on like the state board level and the society level, they thought that, yeah, doctors as a profession should kind of like manage this market.
Yeah, and there's a lot of concessions that they'll make along the way, as you suggested. Medicare Advantage being the kind of thing that's, I think, a great example here. Um, they might have some hesitation or reservation about Medicare being fully run by the government, but if they can have an alternative that's quote privatized, then that satisfies a lot of conservatives. And I think there's, part of that comes down to, I think, a confusion between being pro-business and being pro-market, involving having a little bit of commercialization, involving businesses to carry out or to outsource a government function to that they're often happy with that because now it's not government anymore, right? That's how I think some of them see that kind of solution. And but that's not exactly the same as companies and entrepreneurs and people and business people um, competing against each other on a free and open market without entry, barriers to entry and all the regulations and so forth, where you would actually get a wider variety of solutions and I think that to bring this back to the affordability, that's part of how you bring costs down.
And so I think another thing to appreciate about the conservative approach to reforming healthcare is, well, in contrast to the progressive approach, they're not radicals, right? So and they recognize that a sufficient amount of the American public is hesitant about radical change to the healthcare system, and that's kind of what they're banking on. And their whole way to sell their own approach is that we will preserve what works about healthcare, and we just think that the programs got a little too big and they're not run well, so we're going to save those programs by cutting them. And like really what we want to do is rewind healthcare to what the progressives were arguing for 10 or 20 years ago, right? So they're really just progressives minus time.
A little bit more slow to adopt,
They're
and
slow progressives.
right, yeah,
Or
and or that sometimes there's a slightly more parsimonious way of implementing some program, right? One side wants to set the threshold for eligibility here, and we'll go slightly, smaller to make it different, or slightly more efficient. But that doesn't really get you a real change in any sense. You're just you're just nitpicking over details there.
And so if there's any strategy to the conservative approach to reforming healthcare, I think it's also incrementalism, but it's incrementally ceding things to the progressives, right? And when they cede it, they'll try to fit in their own little reforms. They'll try to enhance choice, where for them, consumer choice means you get to keep your doctor. Maybe you have a more extended network of options, right? But it's not like radical choice. Like you and your doctor and the insurer can come up with different plans to pay for your healthcare. It's like no, like we're going to sprinkle a little bit of consumerism on the socialized healthcare system, and this incremental seeding strategy has very deep roots. I mean, in fact, Otto von Bismarck, who instantiated the first national health insurance program in Germany, why did he do that? He was an arch conservative. Well, he did it because he thought it would take the wind out of the communists and socialists. That if an arch conservative can give a national health program, it'll take the wind out, and then like we don't have to worry about it. And I think that's their approach, and they're like, okay, like we've taken the wind out of it. We don't have to worry about it. But then again and again, these programs keep growing. So if we want to assess their strategy, then I would say that it doesn't really work.
And I think that's true, and we've seen that when in the multiple times in the past 20 years where they've had pretty substantial control of of the government, and they could have done what they wanted to, but they really didn't get much done on this. Multiple times now they've had the presidency and both houses of Congress. Um, and do we have a market-oriented system? Not No, not in the least.
no, in fact, what they did with the Big Beautiful Bill is kind of what you alluded to, Jared. They just changed the eligibility criteria for the government programs to make it so that the population of eligible participants is smaller, and that's how they're saving a little bit of money. That's the major thing that they did.
These like little tweaks, and they can probably be explained by political scientists. I mean, it tends to be a winning proposition to change something where you find somebody who shouldn't be receiving a program, and you propose to change the threshold something. For instance, there's as part of these ACA expanded subsidies, I think the the income cutoff on who can receive these is pretty high. It's something like 600 or $700,000, and so there's some pretty people who are doing fairly well are still eligible for these, right? And so that's like one thing that the Republicans are proposing to change. Okay, well maybe most of us can agree that that's a good thing to change that, but does that really does that fix American healthcare? Hardly. It maybe makes something a couple percentage points more efficient than it otherwise would have been. But it's not right. It's not fundamental change in any real sense.
And it certainly doesn't address the fact that healthcare is just not affordable. The base rate of healthcare is not affordable. And so it doesn't matter if it's more or less, if it costs you more or less money to buy your health insurance, it's still not addressing the affordability crisis in any way. So if both of these groups are essentially practicing incrementalism, incrementally moving us more towards socialized medicine, incrementally trying to pull us back a little bit, but kind of going with the flow, um, are either of them going to save American healthcare?
Yeah, I think that's definitely a relevant question to ask within the current debate about the ACA subsidy extensions, right? Like they're presenting themselves as like offering radically different views, but I think they're not. I mean, and it might be the case that certain reforms might move us in a better direction, but what about after that, right? Let's say best case scenario that there's radical expansion of health saving accounts and deregulation of health insurance on a certain level. Is that enough? Right? And like where are we going? And if you're banking on the conservatives to do that, who don't really have a positive view, have a strategy of just ceding to the progressives, how likely do you think they're gonna, first of all, suggest that, and second of all, even if they do, maintain it and actually fight for it?
Yeah, I agree. And there's additionally there's like a risk too of um of managing expectations not quite well here, right? So like let's say out of this whole debate we get a couple of things like some decent HSA tweaks and maybe they even switch around play with the short-term health insurance option there, right? That's something that was it was set to be quite long so that you could actually get short-term health insurance and which were and those plans were exempt from certain ACA regulations, and so those were quite good as like an alternative or a backdoor around this. But then those were changed to under Biden. Anyway, let's say we get a couple of small kind of changes like that. Even if those are good things, they're not going to be enough to really change everything. And then who gets the blame for when they don't really fix things? Uh, that's they'll look as though they've failed, even those are probably small, good, perfectly good ideas, and maybe they can be part of a bigger plate of reforms. But by themselves, they're not going to be enough, and so they'll actually look disappointing.
Yeah, I
I
think
think.
it's important to recognize that if people agree about a moral goal that they want to achieve in the future, they'll be willing to put up with all sorts of policy failures along the way to get there, right? And of course, there's a question like, can I even get there? Like, is it even a goal that you can achieve? But if people don't agree with the goal and your policy moves you in that direction, and the policy wasn't right, and then like didn't fully execute or wasn't enough, well, then they'll repeal it. It's like you have no momentum going forward. And I think that's definitely an important thing that we should recognize is that if we look at this landscape of approaches to reforming healthcare, there's no real movement for freedom in healthcare. The progressives have the momentum. They want more and more government control of healthcare, and the conservatives just want to slow it down and here and there give patients like a little bit more choice within the programs. That's it. So with that, what would an actual pro-freedom approach look like?
Ray, I think there are a couple of different ways of conceptualizing freedom. So, on the one hand, I think conservatives really are just looking at freedom as freedom of choice. And doctors are thinking of freedom as freedom to maintain the doctor-patient relationship. And progressives are looking at freedom as freedom to have access to healthcare no matter what. So I think first we really need to define what we mean by freedom when we say that we want more freedom in healthcare.
Yeah, and I think what's important to communicate there is that real freedom in healthcare is radical, right? We don't really have freedom in healthcare now. Even where you think you do, and you think of, oh, well, I can go see this doctor and that doctor. There's all sorts of ways in which that interaction is not free. Like you're not free to see them in other conditions, and they're not free to sell you certain things under certain conditions, right? Like, and that's like the whole history of American healthcare is basically the acceptance that, well, we need force to arrange these relationships because we need to protect patients and doctors from the greedy profit motive and from each other. To the extent that there is an acceptance that freedom has a value here, is that it's freedom and force, right? Like we need to set maybe broad rules and like, sure, we'll let you choose your doctor, but how you pay your doctor, like, well, we want you to take insurance and we want the insurance to cover everything or like a lot of things. And that's how we're going to control the cost of healthcare because we basically don't trust people here. And I think what we really have to be clear and radical about is that you need freedom in healthcare. Healthcare is a product of the human mind, and doctors need it in order to come up with new values. Patients need it in order to define their values in healthcare. No one else can do that for them. They can do it in consultation with an expert, but fundamentally, health is very, very personal. And you need the freedom of businessmen to figure out the best possible ways to bring those two together, doctors and patients.
I often think about the kind of the core value as being linked to the each person's ability to kind of live their life as they want to and as they see fit, and that entails a whole choice of different values, right? I mean, we're all here. We're talking about healthcare, but healthcare or health is like a part of your overall life, right? It's not the, or at least I don't hold it as like the ultimate value. It's in service to being able to live out your life and choose your other things in your life that may be valuable. I like thinking about protecting and preserving people's right to live their life as they want and pursue their values, and then the political freedom and the economic freedom as a means to letting people achieve that. That pointing us in the direction of markets being able to function as they best can to provide those the goods that you need, the services that you need, so that you can pursue your own health and freedom, as you see fit.
Yeah.
Yeah, I mean, I sometimes think about doctors setting a price, patients agreeing to pay a price for healthcare as really just a signpost pointing to what they want, what doctors are offering and able to offer, and what patients value. And I think it's really important to think about even health, taking into account your health has a wide span of what someone might decide as a value to them. Examples from my own practice are, for example, a cancer patient who I had who chose not to take the standard of care chemotherapy because that chemotherapy for her cancer would cause nerve damage to her fingers. She happened to be a concert pianist. Even knowing that there was a chance that the alternative chemotherapy would be less likely to work for her, it was more important for her to choose a different chemotherapy so that she could maintain this other value, her ability to play the piano. It's recognizing that there's so much more to how you judge your health and what's important to your health than just the cost of it, than who pays for it. And it's only in having the freedom to have a free economic relationship with your doctor that you're also able to incorporate some of these other values.
A free market can provide that your pianist patient with the ability to make that kind of custom choice. But what government reimbursement schedule is going to be detailed enough to possibly, know and or take into consideration that kind of thing. You can't design that sort of stuff, but you can leave people free to make arrangements with between patients, whether we're talking patients and their physician, or um, you know, people working with the pharmaceutical industry or the healthcare industry or the hospital that you're at, et cetera. I mean, there's so many different relationships in healthcare. That's part of what makes health policy very, very challenging, and it takes a long time to just to even get up to speed to know how all these relationships work and everything, and to imagine what markets would result in and look like in each of these areas, because they're almost like each one of them is a problem and a challenge in itself, but nothing that can't be made much better with free markets.
And so I think what's relevant to point out there is that a radical defense of freedom, in contrast to the way that conservatives defend freedom, is that we don't just need freedom because that'll make the system more efficient, right? We need freedom because without freedom, we can't form values really anywhere, but including in healthcare, right? Patients who are in a heavily socialized system, well, good luck pursuing personalized healthcare. It's one size fits all. And if you want to do something different with your doctor that's outside of the normal way of doing things, well, good luck. You either have to go outside of the system or even outside of the country. And so freedom is important because it provides the basis for deep personal moral values. It's not just, oh, we need freedom to save the heavily socialized system from itself. No, we need it because it's our right. And this is how we value things, how we create new values. And you should not be apologetic about that in any kind of way. And also make clear that this is not the status quo. This is not what we have. And we don't want to just go back to what we had 10, 20, 30 years ago. We want something radically new. And with that, I think it's important to realize that, well, just because it's radical and a lot of people will need persuading, that doesn't mean we can't do things now to move in that direction, right? So that it's not just like some pie in the sky. We have to wait decades to get any movement on this, is that we can make real movements. And if anything, I think we should learn from the progressive approach to healthcare, right? They realized that they had a radical vision for healthcare. They weren't able to achieve it in one fell swoop, so they took an incremental approach, and they saw each step along the way to what they wanted. And I don't see why we can do the same thing. And each time along the way, we can explain to people that, yeah, freedom, a little bit of more freedom here is good for everyone, not just because it makes things work better, more affordable, but because you need it to value health.
As we discussed, the progressives had at least the clarity of sort of setting the agenda in many ways, right? And it was the opponents who their political opponents, conservatives, kind of playing defense constantly on that. And a real way to flip the script would be to introduce into this policy landscape a real ideal on the other side that is that's market oriented, putting both conservatives and progressives kind of on the defense there. And it's not easy, right? And you have to not just explain how why this view and why these values and why it's important to view healthcare through this perspective, but also along the way you have to show that it works, right? That requires getting some wins along the way, and building up an evidence base as well. It's a long-term project, but I think it's absolutely worthwhile and worth doing. I think we can all predict where things are going if we don't do something like this, and it's not good.
So, given all of this, how should we think about what's on offer from both the progressive and the conservative approach to healthcare? How confident should we be that they can tackle not only affordability, but all these other issues in the healthcare system where even if you can't afford it, it's a complete mess. Like who 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 should we trust?
I'll jump in and say that the progressives, what we've come to expect from them is a continual push toward expansion of these programs, and it's very predictable. It's not very creative, to be honest. And but then on the from the other side, you get the possible slowing of that. So you get the basically the same result, but at a slower pace, and with an occasional nod to an actual kind of market-oriented idea that gets, plugged in there somewhere along the way, but isn't really allowed to do its full job and able to function and generate as much of the benefit as it could in different contexts. And so I don't really see any real progress coming from either of those two dynamics. I see it's sort of a slow slide in one direction, and I don't see it ever changing direction. And so that's why I think we need a different approach altogether.
Yeah, I think I would agree that on the one hand, you have the progressives working on trying to make things more affordable by increasing the cost to taxpayers so that individuals feel like they're paying less. On the other hand, you have the conservatives trying to make things more affordable by decreasing the cost to taxpayers and making individuals have to pay more, the individuals who they deem to be the ones who can pay for it. And in the end, we're all losing our freedom to exchange in a way that we each individually can judge to be supportive of our life. And I think that's partly why we're starting to see such discontent in medicine on the part of doctors feeling this moral injury all the time, and patients always feeling as if they're never able to get the medical care that they want or need. And so really we need to stop, I think, thinking about what's affordable and start thinking about what supports our values.
So, Colleen, I agree with what you're saying about affordability, and affordability is a value, but the problem is that putting these issues in terms of affordability simply doesn't really do it justice because why are people concerned about affordability? Well, they can't afford things, but what does that reflect? People feel like they're not paying for what they can get and they're not getting value for money and they feel like they're being screwed in the system. It's a symptom of a wider problem and wider distrust in the system that we have. And so what you would really need is some kind of indication in your approach of the fact that you think the system is broken, which other people have done, but then an actual alternative. And from our perspective, both the progressive approach and the conservative approach don't really offer a real alternative. It's like the whole system that we have right now is a consequence of their approaches, right? And so what we hope to have done in this episode is make a little clearer what a real pro-freedom approach is to reforming healthcare. And once the dust has settled on what specific policy solutions come about after this whole ACA fight, we can hopefully start applying that to those specific solutions to think clearly about what next steps will bring us closer to more freedom in healthcare. And with that, I'd like to thank our audience. Until next time.
Till next time.
Thank you very much.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.